The project will cost about $4.3 billion and is expected to run over the next 5 years. It will mainly focus on research and support efforts to eliminate malaria.
And we're jointly committing £3 billion to eliminate malaria from the world. By using great British science, like we see here in Liverpool, we can not just save lives, but we can create a more secure world. That's overwhelmingly in Britain's national interest, and it's exactly what people want to see our aid budget being spent on.
There were 438,000 malaria deaths in 2015. Most of them of children under the age of 5, and the majority of them in Africa. That's according to the World Health Organization. The World Health Organization also says in its World Malaria Report of 2015, efforts to control the disease have made significant progress in the last 15 years, but are threatened by the spread of resistance to anti-malaria drugs and to insecticides. Microsoft co-founder Bill Gates has turned much of his philanthropy towards fighting disease under the auspices of the Bill and Melinda Gates Foundation.
Well, malaria is a terrible thing. There's hundreds of millions of people who get it. It holds back economies. It kills over 600,000 children a year, almost 10% of all the children that die before the age of 5. And we have some really great science, whether it's Liverpool or Imperial or Oxford or some partner institutions. By taking this research money and coming up with new interventions, the scientific community has agreed that by 2040 we can get rid of this disease. And so for all the countries, this would be very, very transformative. Their kids would grow up far more healthy, they could have their own economies and be self-sufficient, and we need to help them by getting rid of this disease.
The charity has disbursed more than $28 billion and provided funding for the world's most clinically advanced malaria vaccine, Mosquirix, developed by GlaxoSmithKline. Mosquirix, or RTSS, is the first malaria vaccine to reach phase 3 clinical testing, the final stage before market approval, and the first to be assessed by regulators. It received a nod from the European regulators in July. A World Health Organization expert panel in October recommended pilot rollouts of the vaccine to young children in several areas of sub-Saharan Africa before considering wider use. The World Health Organization is expected to follow the panel's recommendation, which could result in Mosquirix being the first licensed vaccine against a parasite disease. But a final decision is still some way off. Susan Mongeli, CCTV.